Good afternoon, everybody. I'm Hilary Shager. I'm the Associate Director at the Institute for Research on Poverty, and I'm absolutely delighted to welcome everyone here today to our weekly seminar that is coming to you virtually this afternoon. And although we are virtual, we still really want this to be an engaging discussion. And I want to encourage everyone to please use the Q&A function that you'll see at the bottom of your screen, probably maybe at the top, that has a couple little dialogue bubbles. So Q&A, you can put questions in at any time. For our speaker, Dr. Cynthia Osborne, I'll be moderating that function. We are happy to take, if there are clarifying questions, I'll jump in and ask Dr. Osborne to answer those, but then we'll also leave some time at the end for a longer Q&A session. So again, please feel free to type in any questions that you have in the Q&A section down at the bottom. If you have any trouble with technology, please feel free to throw a question in the chat, and our wonderful tech person, Dawn Duran, who does a fabulous job, will help you out. So again, I'd like to welcome you today and to introduce our speaker, Dr. Cynthia Osborne. Very excited to have her here from the Lyndon B. Johnson School of Public Affairs at the University of Texas at Austin. And we're going to keep the introduction short today, but just to give you an idea, I can do a full introduction just based on the many different director titles that Cynthia has. She is the Associate Dean for Academic Strategies, the Director of the Center for Health and Social Policy, the founder and director of the Child and Family Research Partnership, and the director of the Prenatal-to-3 Policy Impact Center. And this is a new resource for state leaders for the evidence on policies that strengthen outcomes for infants and toddlers. So that is a lot of director hats to be wearing, but we're really excited to have her here today to talk about that more recent effort around Prenatal-to-3 Policy Impact Center. And that is what she'll be presenting on today, a roadmap for states to build an effective prenatal-to-3 system of care. And we're very excited to have her, certainly of interest to us here in Wisconsin and throughout the country, given some of the state preschool development grant work going on and a lot of initiatives and energy around early childhood. So without further ado, please welcome Dr. Cynthia Osborne.
Thank you, Hilary. I really appreciate it, and really glad and grateful for the opportunity to be able to share what we've been doing with you folks at the Institute for Research on Poverty. I even wore my red in honor of my great colleagues at Wisconsin. So thank you. I'm going to share my screen and go through some slides. And like Hilary said, I really do encourage you to ask questions, and I'd like to be able to engage in as much of a conversation as possible in this virtual environment. Let's see if I can make these go full screen. So I am very excited that we were able to launch the Prenatal-to-3 Policy Impact Center just a couple of years ago. And really the whole purpose of this center is to be a resource for the field, and especially state policy leaders, as they have tried to really strengthen the system of care for our infants and toddlers and their parents. And I probably don't have to, this is probably not news to folks here, but I want to kind of step back and really set the stage for what motivates our work and why we're doing this. The science of the developing child has really grown over the last decade or so, and it helps us to really clearly understand how important this prenatal to age 3 period of development is. It's the most rapid and sensitive period of development. The brain is forming more than a million neural connections per second in this time period. And so we know that the environments that we create for children during this time period really have long-lasting effects on their health and well-being. That the research is clear that if children who are exposed to nurturing environments in these earliest years are set on trajectories for healthy neurological, biological, and social development. But by contrast, children who are exposed to chronic adversities such as severe poverty, trauma, or neglect, that these are children who are not able to reach their optimal development, and that it can have lifelong consequences for their health and well-being. And unfortunately, millions of children are not granted the opportunities that they deserve in these earliest years through lots of reasons, from living in poverty, for not having housing stability, or they may be food insecure. But systematically, it is children of color and children of lower levels of income who are really deprived of the opportunities that they so deserve and need in order to get off to this healthy start. And just as the research on the science of the developing child has become more robust, so has our understanding of the importance of state policy choices in shaping the opportunities and outcomes that children have. And we know that state policy choices can lead to situations in which the parents are empowered to provide and nurture their children, and creates these conditions that allow children to grow up healthy. Or it can do just the opposite and not create those conditions and make it so that families are struggling. We also know that it's extremely important that we not only focus on policies that support children, that we have to care for the caregivers who are caring for the children, especially in this prenatal to 3 period of development. Those nurturing relationships are so important. And so helping the parents, childcare providers, and others who interact with children to create those nurturing relationships is essential from a policy standpoint as well. It's also clear that there is no magic bullet. There's no one program or institution that can do it all, but it really does take creating a system of both broad-based economic and family supports and more targeted interventions in order to create these environments in which children can thrive. But right now, there is great variation in the types of policies that children and families can benefit from across states. There's really this patchwork of resources that are available to families just based on where they live. And again, states can choose to enact policies that actually strengthen families, or they can choose not to, and that's going to create struggles for so many families. So based on that science of the developing child, we've identified 8 prenatal to 3 policy goals. And again, these are the conditions that children need in order to thrive from the start. We need to make sure that families have access to the services that they're eligible for, that parents can balance both caring for their children and working, that they have sufficient resources, economic security, housing security, food security, and so forth, to actually provide for their families. That children are born healthy to healthy parents, and parents have both physical and mental health that they need to be those nurturing caregivers. That parents understand children's development and have the skills and understanding of how to interact and create those nurturing environments. And when children are not with their parents, they're in these nurturing childcare environments in which others are caring for them in the way that we know promotes healthy brain and body development. And if we identify any sort of developmental delay, we need to do it as early as possible and to get children into the types of services that can get them back on track toward healthy development. So these are the goals that science tells us are necessary. And we wanted to understand how families are doing across the United States with regard to these sorts of goals or these sorts of environments, and how that varies state by state. And so we attached a couple of indicators or outcome measures to each of these goals that are most commonly data that are available across all states plus DC, but also that are measured in most of the research. And you can see that there's just wide variation across states. And the worst state is really the state in which children or families are faring the worst, and the best is where children and families are faring the best. And you can see where Wisconsin fits in the middle with these different outcomes. And so you can see the variation in access to services, in parents' ability to work, insufficient resources, and healthy and equitable births. And in some instances, we're talking about magnitudes of 5, 6, 8 times the difference in between the best state and the worst state. And it's true for these other policy goals and outcomes that we have as well, with regard to the parents' emotional well-being, the nurturing relation or interactions that children are exposed to, and so forth. I'm not saying that these are the only outcome measures that really matter, but they do paint a picture of how children and families are faring across our country and within your state. So because we know that what the conditions are that children need and that there's a lot of variation in those, our goal was to identify what the state level policies are that are the best investments that states can make to actually create those conditions in which children can thrive from the start. And before we kind of got into doing this, we set some of our kind of guiding principles of what was going to lead our research moving forward. And we wanted to make sure that we continue to come back to the science of the developing child that tells us what the needs are for children. That the whole reason that we're doing this is to make sure that we can create more equitable opportunities and outcomes for children. And we want it to be guided by the most rigorous evidence that's available to date to really understand what we know about what works and what's still left to learn. And I'll kind of cut to the chase on that. We have a lot left to learn. We have done, there's a lot of research that's been done, but there, as one of my colleagues said, we basically have created a list of dissertation topics for the next 50 years. There's so much left to learn here. But the whole idea of creating this roadmap was to really be a guide for state leaders who have recognized the importance of getting kids off to a healthy start, but have lacked information on the best way to go about that. And so to be able to show and demonstrate that these are the most effective policies that you can implement in order to reach your policy goals. And in the research that we've done, and I'm going to share with you, we've identified 5 policies and 6 strategies that have this demonstrated impact on prenatal-to-3 outcomes. And in addition to just saying what works, we want to actually help track states' progress toward adopting and implementing these policies so that states can learn from each other, be motivated by one another, and we can ensure that over time, the outcomes of our children and families are actually improving because of these policy changes. So I wanted to make sure that you're all aware of this resource that we have. In addition to the roadmap, we started by reviewing every policy that we could possibly get our hands on that's been studied in any way. And we've to date done, completed over 24, and we have more in our queue. But if you go to pn3policy.org/clearinghouse, they're actually being updated as we speak for our big event next week. But you can see all of the different policies that have been reviewed. And this is about looking at the causal studies that have been done to understand whether there's sufficient evidence to say this does impact our prenatal-to-3 period, or whether we actually need further study on this. And like I said, for so many of these policies, especially with regard to childcare, a lot of the research is focused on 3 and 4-year-olds and not enough on infants and toddlers. So we're committed not only to just seeing what works, but building that evidence base so that we can learn more and make sure that we're informing the field as we move forward. So the website right now for the roadmap is not, it will take you to the old roadmap, but if you are interested in live on October 7th, you'll be able to get the brand new roadmap. So we have an event coming up next week. And in addition to creating a roadmap that is US in general, each state also has its own roadmap that provides all the information that's specific to the state. And so I'm going to share with you kind of what really is in that roadmap, but more today talking about the evidence of why we chose these, especially the particular policies that we chose. And I want to, this framework is really what we consider to be a useful guide for states. The columns here are those 8 policy goals. And in our research, we identified what the effective policies and strategies are and how they align with those policy goals so that states can determine which goals they want to prioritize and therefore which policies they would want to implement or prioritize first. That there are some policies that have a kind of wide reach and impact multiple goals, and there are others that have a more targeted approach and impact only a few. And there are some, by contrast, or you can also say with the goals, there's some in which lots of policies will work, and others in which you need to be more specific. And this is the same for our strategies as well, in which there is more targeting with these strategies. They're kind of intended to meet specific goals more so than the policies. And so you can see how these things align. And I'll go into more detail a little bit about each of the policies and strategies as I move through this talk. But one of the things that's a little different from the work that we're doing than some other work that has looked at whether states have adopted a policy or not is that we set a little bit of a higher bar, that for states, we established kind of what is the floor that is necessary in terms of the benefits that will actually lead to the outcomes that the most rigorous research says makes a difference in children's lives. And so, for instance, with paid family leave, we're not suggesting that 6 weeks of paid family leave should be the goal that all states strive for. What we're saying is that the research was mostly done on California's paid family leave program, that until recently only offered 6 weeks. So all the research that we have really tells us what a 6-week program would do. And it's possible that an 8, 10, 12-week program that some states are implementing now would do even more. But that's why we're saying it needs to be a minimum of 6 weeks in order to make this impact. And there was at least one state that up until this year was offering only 4 weeks. And so they didn't get quote unquote credit for that policy. Similarly, the information, all the evidence that's been done on state minimum wages were done on wages around the $10, maybe $11 mark. Now, as states are starting to implement wages that are higher than that, and families have access to those, then we can start to really understand how an increase in wages up to a $12, $13 threshold might impact family well-being. So we set this standard based on what the most rigorous evidence to date tells us. But the policies include expanding, these are, like I said, these more broad-based economic and family supports, expanding Medicaid, making it so that families can actually access the benefits that they're eligible for by reducing administrative burden. And we use SNAP as an example for that. Paid family leave policy, a state minimum wage, and a state earned income tax credit. And we also identified these 6 strategies. And the difference between a policy and a strategy is that the evidence with regard to policies says not only does this work, but here's what the evidence says is needed in order to get that impact. You need at least a 10% refundable earned income tax credit at the state level in order to see some of the impact on that prenatal-to-3 outcomes that we see in the research. So by contrast, for the strategies, the research says these things work. The most most rigorous studies to date have demonstrated causal impact on prenatal-to-3 outcomes. The research doesn't provide us guidance yet on exactly how states should implement it. How much should they fund it? What should the child care subsidy level be in order to make sure that families have access to affordable and high quality care? So these things are called strategies for now, until we can learn more and make it so that we can move these to policies, if you will. So rather than states getting a yes, no on implementing these strategies, we have identified the states that are kind of leading the way. They're able to serve a lot more folks. They're actually being innovative in what they're trying. They're investing quite a bit. And so we kind of look relative to other states and say, these are the states that others may want to watch if they want to kind of learn how to do this strategy well. And these strategies include what we call comprehensive screening and connection programs. These are things like Healthy Steps and Family Connects, where you provide it universally to all families. You identify if they have any needs, and you make that warm handoff for the family to make sure that they have access to the targeted services that they have been identified to need. Child care subsidies that provide access to affordable and high quality care, group prenatal care, evidence-based home visiting programs. We focus just on the parenting aspect there, early Head Start, and early intervention services. So I'm going to spend a minute talking about the progress that states have made over this past year. Last year, we did our first roadmap where we laid out kind of what it is that actually works. And this past year, we've spent our time updating the evidence, but also tracking states' progress. And it's really exciting to see the level of activity that has happened over this past year. As we know, with the pandemic, it's been an awful year for, it's just such an understatement for so many people. And this time last year, we really feared that states were going to cut their budgets and slash programs. But just the opposite has happened. With the infusion of federal dollars through both the CARES Act and the American Rescue Plan Act, that states have had more money and more energy to really try to make a difference in families' lives. And so this kind of is where states stand in terms of the number of those 5 effective policies that they've fully implemented. But if you dig down deeper, it's really the exciting part is the progress and the change that they've made over this last year. So this demonstrates those states that have implemented each of those 5 effective policies. And you can see that there are 5 states this year who have moved onto this board here in terms of implementing one of these for the first time. So Missouri and Oklahoma have now expanded Medicaid. Massachusetts, families there finally have access to their 12-week paid family leave program. Florida, Missouri, New Mexico now all offer at least $10 for a minimum wage. And so this kind of progress has been really exciting for families because it means more resources in their pockets. But there's been even more activity than that. So again, 4 states have fully implemented all 5 of the effective policies, but 3 other states are primed to do that next year. Rhode Island and Connecticut will each implement paid family leave program that's at least 6 weeks now. Washington will fully fund its earned income tax credit. And so there are 3 more that will move on to that 5 out of 5 list in the next year at least, if not more, who will pass things that we don't know about yet. But even below that, there's been a lot of policy activity. And I'm not going to go into all the details here. I'm happy to talk about it, but we've been creating this database that has now about 6 years worth of policy and legislative administrative activity within states. That's going to help us in our research moving forward when we look at the impact of policies. And we usually conduct these difference in difference studies where we look at the policy change in one state and not a policy change in another group of states. And we look at the change in these outcomes over time and compare them. But we often act like policy changes are these exogenous shocks, and knowing more about the momentum and the changes that are taking place within states, how serious they've been about these, the reasons that they have been enacting these policies, all of that will help us to better account for potential heterogeneity that we're missing at this particular time. And so in addition to the policy progress, states made a lot of changes to their, in terms of strategies. And this is really exciting because the changes such as reducing copayment fees for childcare subsidies, or increasing base reimbursement rates, or expanding eligibility. All of these mean that there's an opportunity to get in there and evaluate what the impact of these are, and to know kind of where we're headed and what we might be able to learn from these, and actually provide more direction to states on what really works.
Cynthia, could we have a clarifying question?
Yeah.
Could you explain a little bit more about what group prenatal care is exactly?
Sure. Well, it actually is exactly what it says it is. It's one of those self-explanatory things. But group prenatal care is a type of prenatal care in which groups of women, 8 to 10, meet instead of just individually. They do have a short one-on-one time with their doctor in which all of the kind of medical issues are taken care of, but they meet over the time period so that they can kind of learn from each other, have this social support with one another. And you actually end up with a lot more hours of prenatal care, and it can be financially advantageous for doctors because states have been giving enhanced reimbursements for group prenatal care, or they will pay for kind of the whole group, and serving, instead of one woman every 15 minutes, you're serving a group of 10 women within an hour. And so you're actually able to bill more. So it's better for the doctors in terms of payment often, and it's better for the moms in terms of their outcomes during pregnancy. So hopefully that describes what it is, but centering pregnancy is the most common model of group prenatal care.
Thank you.
Sure. So also in the roadmap, we provide these kind of brief narratives and more extensive narratives for each state so that they can kind of understand how they did over this last legislative session on each of these policies and strategies. So what was introduced, what passed, where they stand relative to others. And this is just an example of our kind of brief narratives on each of those policies. And we have one also on the strategies. I'm happy to talk about any of these from Wisconsin's perspective if you are interested in that later, but I will, for the interest of time, kind of go through a little bit so I can talk more about why we chose these policies and how important they really are for the well-being of infants and toddlers and their parents. So this kind of prenatal-to-3 period versus just kind of overall. So when we know that Medicaid expansion is actually one of the most effective policies that states can implement. Not only does it provide health insurance for expectant mothers or mothers postpartum, which currently, if you haven't expanded Medicaid, many are not eligible for. It also provides a mechanism to fund many of the effective strategies on the roadmap. And so to date, 39 states have expanded Medicaid, and those who haven't, there are 11 out of those 12 who have not, including DC, they considered expanding it last year. And Wisconsin was one of those that considered it, but it didn't pass. And like I said, Medicaid expansion has big impacts on lots of outcomes beyond just the prenatal-3 period, but within this period, it leads to higher rates of coverage during the preconception period, the postpartum period. It makes it so that women are more likely to receive adequate prenatal care, and this is especially true for reducing disparities in the adequate prenatal care. It has a huge impact on the financial well-being of families in terms of reducing any of their medical debt, or making it so that folks are not going to refrain from getting medical care because of the cost. And it impacts the well-being of babies. Babies are born healthier, and it also reduces disparities in birth outcomes. So it's a really important policy for those, and this is parents' Medicaid, not children's Medicaid. That has additional benefits. For each of these policies, we show the transition from last year to this year in terms of which states have adopted it and which states are making some progress in doing that. And again, more about the narrative of what each state has done over this past year and where they stand on it. But in the roadmap, we also provide, there's hundreds of data points, several for each policy that help to illuminate kind of what some of the challenges are and the variation across states. So this is a couple of examples. This demonstrates the variation in the income eligibility thresholds as a percentage of the federal poverty level. And most of you probably know this, but in states that have not expanded Medicaid, childless adults are typically not eligible for Medicaid at all. Parents are eligible, but based on an income eligibility threshold. It has a low of 17% in my state of Texas, and a high of 100% in your state of Wisconsin. And then the income eligibility level for parents, for women who are pregnant, is even higher still. But there's just great variability if you haven't expanded Medicaid as to your income threshold in order to qualify. So in Texas, if you earn more than $300 a month as a mom, you cannot qualify for Medicaid. And these income eligibility thresholds are really highly correlated to the percentage of low-income women of childbearing age who do not have access to health insurance. If you see in Texas, we have nearly half of women of childbearing age who do not have access to health insurance, as compared to the District of Columbia, which fewer than 4% of those women lack health insurance. And they, in DC, offer Medicaid up to 221% of the federal poverty level. So they're even more generous than what the federal requirement is at 138%. You can see that Wisconsin is somewhere in between and actually on the kind of upper half of states in terms of making it so that women have access to care, but still more than 15% lack that. When we look at reducing administrative burden, this is an area that we consider the low-hanging fruit of policy, that these are benefits that are being offered to families. Families are eligible for them, but for various reasons, families are not able to access them. Whether it's that we're kind of intentionally putting up burdens, whether there's stigma, whether it's just unintentional, there are a wide range of reasons, but the consequences are the same, that here's a family who's eligible, but not getting this. And we know that reducing administrative burden can make a big difference. We use the example of SNAP because it is the most effective nutrition program that we have in this country and covers millions of people. And the research is clear that this combination of strategies to reduce administrative burden makes a big impact on increasing the eligibility. So not just making it so that you have longer recertification intervals, but having what we call simplified reporting, where you only have to report changes if it's going to actually change your eligibility threshold and make you no longer eligible, making it so that you can access services online. All of these things make it so that families are much more likely to access the services that they're available for, or eligible for rather. And you can see the variation across states. In California, over 25% of folks who are eligible are actually not receiving the SNAP benefits that they can get. In Wisconsin, the number is at 6%, 6.7%. And Wisconsin's one of the 22 states that have, or 26 states that have made it so that families can access SNAP in a way that reduces that administrative burden. With paid family leave, this is another policy that has now been enacted by 10 states, but fully implemented now by only 6. And it ranges from a low of 4 weeks of paid leave to up to 12 weeks of paid leave. And the way states implement this varies quite substantially. If there is a federal law, we don't exactly know what that's going to mean for states and how they will implement it. But there's wide variation in terms of the how much folks reimburse you per month or per week for your salary, the number of weeks that you have off, who's eligible for it, and so forth. But this is a program that has an impact on 6 of these 8 prenatal-to-3 policy goals. These 3 show that it actually allows more women to take time off following the birth of their child. Currently, with unpaid leave, very few women are able, or not enough women are able to take that paid time off. And disproportionately, women of color are the ones who either don't take any, take 2 or 3 weeks of leave, or really move out of the labor market. We know that it also is good for the economy, and that it keeps people attached to their jobs and returning to their prepartum jobs. And it has a substantial impact on household resources in the years following birth. It is good for parents in terms of their emotional well-being and some of the other risk factors that we know. They're able to lose some of the weight. They are less likely to consume alcohol. And it increases that time that moms are able to bond with their children. And it has really positive outcomes for the children directly. So it's one of the most effective policies that we can do for helping the kids get off to the healthy start. And there's been a lot of momentum here by states. 23 states actually considered adopting paid family leave programs. Additional 4 states are going to implement a full 12-week program within the next couple of years. So there is a lot of momentum here. But not every state has gotten off the mark, that's for sure. This is just for a resource. So you can see we go into great detail about what is available for states and how they're funding it, so that states can learn from each other about what might work well for their state. So the 4th most effective policy, and these are not really in order of effectiveness, just all 5 of them working together can really improve the well-being of families, is the state's minimum wage. That's at least $10 an hour. The federal minimum is $7.25, and it hasn't been raised for over a decade. And we know that at $7.25, a family is earning just over $15,000 a year for that worker. Even $10 an hour doesn't lift a family of 3 out of poverty. But this is what the research to date says is the floor that you need in order to get some of these important outcomes. And one of the things that I think is so interesting is that a minimum wage not only does what we would think of as the obvious, which is give more resources and maybe reduce poverty here, but it has one of the biggest impacts on birth outcomes of all of the policies, even those that are more targeted at specific birth outcomes. And it actually shows that it has impacts on child abuse or child neglect. And some of the effects are kind of long-lasting effects through their years in school. So being exposed to higher minimum wages in the earliest years actually has longer-term impacts. And when we look at the states, again, that have fully implemented a $10 minimum wage or more, you can see that like I said earlier, these 3 states, Florida, Missouri, and New Mexico, kind of joined the group of yes this past year. And there'll be 11 states that offer $15 an hour by the year 2026. So within 5 years, if the federal government doesn't make this change, more and more states are going to. Currently, only in the District of Columbia can folks get more than $15 an hour. Certainly in some cities, this is available. But there are many states that still offer the federal minimum $7.25, and other states that offer higher than that, not quite at 10. But there's been a lot of momentum this past year. Every state introduced bills. They just didn't pass in every state to increase the minimum wage. And finally, the earned income tax credit. We know that the earned income tax credit at the federal level is one of the most effective policies that we have to reduce poverty and improve children's well-being, and that it is this bipartisan policy that seems that everyone finds something in it that they like. It encourages work, it helps families, and it really does make an impact on the well-being of children. And 18 states have a refundable earned income tax credit of at least 10%. Other states have a tax credit, but it's either not refundable or it's not fully at that 10% mark for everyone who's available. And Wisconsin falls into that group of states where you have a state earned income tax credit, but for families with only one child, they only get 4% of the federal EITC. And the research doesn't show that actually has an impact on that child's well-being. But again, similar to the minimum wage, not only does the earned income tax credit help incentivize folks to work more and give folks more income into their household, it actually has a huge impact on birth outcomes and reducing disparities in birth outcomes. So it's often those things that you are not usually on the agenda for child policy or thinking about how you would strengthen the outcomes for children that have the biggest impact. And it's really increasing the resources in families' households that makes a difference. This shows kind of where states are, and there weren't any states that moved from a no to a yes this past year, but there were 9 states that increased the generosity of the earned income tax credit this past year. And 2 of those states will actually move to yes next year, Indiana and Washington. On the roadmap, you can kind of go through and find out where each state stands on that. So in the interest of time, I'm just going to share with you kind of information on one of the effective strategies. If you're interested in learning about any of the others, I'm happy to. I just know that childcare subsidies is an area of interest to many, and it's part of the conversation that's going on right now at the federal level of how and why we need to subsidize childcare. Childcare is unaffordable for families and unprofitable for the providers, and it is an essential for folks to be able to work, so essential for our economy. But it's kind of unclear how states should really implement this in order to make it so families can access high quality care that's affordable to them. And the research is clear that childcare subsidies do lead to more parents working and to increase their earnings. The research to date has not extended all the way out to quality. And most of that's because so many of our centers are not the type of level of quality that we really want. And the subsidies are not necessarily ever large enough to get us all the way to that level of quality that we need. So to date, we still need to learn more about that aspect of how subsidies can promote greater quality. This is a slide that you should all show students about what not to ever include on the screen. It has way too much information, but it's just to illustrate what I'm going to show you in more detail, how the variation across the country in childcare subsidies. The length of each of these bars is the market price for childcare within a state that we call the 75th percentile. It means that that price, a family could access 75% of the childcare slots that are available in a particular area within a state. And in this case, we're choosing the most populous area in a state. So that length of bar is based on, is the market price. There's been estimates to show that that market price usually under kind of prices the true cost of care. The cost of care is actually higher for most states if we were to pay teachers what they deserve and if we had the ratios that students need and so forth. But the length of the bar is basically what the providers get. And The first blue bar is what the state pays directly to the provider. The darker blue bar is what the state requires the family to pay to the provider. And so the combination of those two are what we call the base reimbursement rate that a state has and says, okay, regardless of whatever the price is, this is how much we're going to give to what providers can get. That teal bar is the difference between that base reimbursement rate and that market price of childcare at the 75th percentile. When it's that teal color blue, the state says providers, you can tell the families that they have to pay that to you, and the families would have to pay that in order to access that higher quality care. In the instance of Iowa, where it's gray, the provider just has to absorb those costs. The state doesn't allow providers to charge families additional fees. So that's the kind of what childcare subsidies look like. And the variation across states and within regions is just quite high. And in addition to covering that kind of full cost of care, which Wisconsin actually does a pretty good job of covering the price of care. Now, there's more, like I said, to really get us to that true quality. But in some states, we pay a lot of attention to the percentage that families are expected to pay, the total burden on families, and whether the state is actually meeting the true cost. So this is the range of what's called monthly copayments as a percentage of income. So although providers may get quite a bit, in Wisconsin, families have to pay 11% of their income, so family at 150% of the income level, to be able to access care. And so that puts Wisconsin in kind of the bottom 5 states on this indicator. And you can see in some states at this income level, the family's not expected to pay anything. And the average, the median is somewhere between 5 and 6%. But when we look at the total cost of care, how much families have to cover of that full bar, in Wisconsin, the family is expected to cover nearly 30%. In some places, like in Texas, it's more than half of the cost of care. And in other states, as you can see in the top left there, it's very small of the whole cost of care. And when families have to pay that much, it's a disincentive for them to use higher quality care or to even enter into the labor market. And this demonstrates, if we were to take what we call this base quality true cost of care, that makes it so that it's more realistic in terms of how much you should be paying providers, what the size of the classes should be, and so forth. These are estimates done by Simon Workman at Center for American Progress when he was there. And this shows that Wisconsin's paying, current base reimbursement rates cover only about 87% of that true cost of care. Okay, these are my last slides to just try to show you how all of this works together. I just showed you these 5 different policies and childcare subsidies. And when we think about how they interact and really provide resources for families, I want to show how sometimes state policy leaders might not be thinking about these intersections of these policies and the impact that it can have on families' resources. So I'm going to use Wisconsin as an example here, but every state kind of has this going on to more or less degrees, and I'll show you Minnesota and Illinois as comparisons. But I take a stylized family of a mom who has an infant and a toddler, so 2 children, and she works at a minimum wage job based on the state's minimum wage. And I'm going to demonstrate the total level of resources that mom has available to her to provide for housing and transportation and so forth over the course of a year. Some of these benefits occur monthly and some are more annual. So in Wisconsin, the mom earns $7.25 an hour. She works full time and again makes just over $15,000 a year, which is far short of the federal poverty level. But she has to pay out of pocket in order to access childcare. The assumption is that she's leaving both of her children at a high quality childcare center at the 75th percentile at least. And so this illustrates the out-of-pocket child care expenses that the mom would be expected to pay, which would reduce her earnings that she has less to provide for her families. When we add in the additional benefits that she's eligible for, the nutritional benefits and the federal and state earned income tax credits and child tax credits, then you can see that the level of benefits over the course of the year actually go up quite substantially, and are now close to $30,000 a year. If we were to add in the temporary ARPA, that number would go up another $8,000. So that we didn't include that for now because it's just for the 1 year, but it would be substantial for so many of these families. But I want to compare that to another state that has a higher minimum wage, and to show how these policies can intersect, and some states can really lose the value that they are having on from one policy kind of can hurt another. So in Minnesota, their state's minimum wage is over $10 an hour, and that's nearly $6,000 more a year that this mom is earning in Minnesota. Again, she's working the state's minimum wage, and she has an infant and a toddler who she leaves in center-based care. And in Minnesota, the childcare costs, the out-of-pocket childcare costs are substantial, nearly $10,000 a year that the mom has to pay, which substantially reduces the amount of earnings that she has available to her to be able to provide for her children. Yes, when we add in SNAP and WIC and the earned income tax credit, certainly the level of resources increases over the course of the year. But instead of having close to $6,000 more in benefits, she has something like $600 more in total resources, or in earnings rather, in total resources because of out-of-pocket childcare expenses. And so it's just crucial that we think about how much our childcare costs in order to allow folks to stay in the workforce. So kind of adding up all those benefits that are in this roadmap, here are the resources that families have available to them. Just to add in another state of Illinois, where they actually have a higher minimum wage, and their out-of-pocket childcare expenses are somewhere in between Wisconsin and Minnesota's. So they don't lose as much as they did in Minnesota, and the family ends up with more resources at the end of the year that are fairly substantial. This just demonstrates the kind of range across all of the states in terms of that total level of resources, that last bar. Again, this is pre-ARPA, meaning that there's temporary benefits that are higher, so up to $7,200 in the child tax credit, up to $8,000 in the child dependent tax credit. That can make a big difference for families. But here is what states look like based on their current roadmap policies, if you will. And you can see that it's a doubling from the same family, mom working a minimum wage job with an infant and toddler in North Carolina. It's only $21,000 in resources. In the District of Columbia, that same mom has $42,000 in resources. And that's a big difference when you're trying to care for two little ones. Well, I am going to close out, but I do invite you all to join us at our big event that we're going to be hosting next week. This provided somewhat of a preview of what others are going to be seeing, but there's a lot more. We have a lot of state legislators and policy leaders who will be joining us, and will be sharing more of the roadmap, and it will go live that day. So I'm going to stop sharing now and hopefully answer all the questions that you might have.
Thank you so much, Cynthia, for that terrific presentation and preview of a very, very exciting resource for states. We really appreciate it. I do want to encourage people to put questions into the Q&A. We have some time here, so and a great resource, so please do that. We do have one question in the Q&A right now, which is, do you have analysis that factors in costs of the policy? So you kind of showed that for individual families, but maybe for more of a macro cost benefit level.
Yeah, it's a great question. And we do have some of that information. We have two types of information in the roadmap where we demonstrate how states are funding these policies and the level of spending that they're using. And the cost of the policies varies considerably.
Whoops, I think you're frozen.
Oh, no. Uh-oh. Oh, boy. Let's see. Let's see. I don't know if I'm frozen for everyone or not. I apologize. Let's see. Maybe Hillary's frozen and I'm not. So maybe I'll keep talking. My apologies if I am. Okay, so I'm not frozen this time. I froze earlier today, so I thought for sure it must be me. So we have two types of information in our roadmap with regard to costs. And the first is how states are funding it and the level that they're spending. When it comes to the actual cost of the policies, that's going to vary quite a bit based on the generosity. And so we've been working with some states to do these cost estimates for them. If you want to increase your earned income tax credit from 10 to 20%, what is the actual cost outlay? What would be the cost avoidance on other sorts of things? What might be some of the return on investment? So those are things that we're looking into, but it's hard to put a price tag on the roadmap simply because every state is doing something so different. And we could just put a floor on it, but right now some states are already well above that floor, so it makes it very difficult to do. So that's a really bad answer to your question, but it is kind of the reality of where we are.
Thank you so much. That sounds great. And again, looking forward to watching that continue to evolve. And my apologies, I got kicked out of the Zoom for a minute there. So
no, I thought it was me. So
okay, we're all back. So that's wonderful. So we have another question in the health domain, sort of related. In the health domain, there's been a large body of comparative effectiveness research. What is there in the child policy area? The count of policies approach suggests that each is equally valuable. What research base is there to reply to someone who asks, which of these would be most valuable to do next?
That's a great question. And the work that's being done on kind of measuring the marginal effectiveness of policies, I think is so important. And we haven't done it for all of these policies yet. And so I don't have it's something that we're going to actually try to do, is to understand kind of the relative impact. And when you saw kind of adding up those resources for a family, you can see the ones that really go a long way versus not, and which ones states have to pay for versus which ones the feds have to pay for. So we have some insight as to how to do this. But what we're really trying to do more of is to say, what is the state's goal that they have? Because not every state has the same sort of goal or wants to prioritize things. Some want to focus on healthy birth outcomes. Some want to focus on financial resources. We know that all of those goals are important, but hopefully this provides some guidance on where to begin based on the goals that a state has. But I really do like this idea and would like to do more of it. I've been doing health policies to say, so which are the ones that would give you the biggest bang for your buck? Which ones kind of, should you start with? So I think it's a great question.
Great, thank you. And again, keep those great questions coming. I'm going to take the opportunity to ask a question myself, which is, I know in Wisconsin, with some of the preschool development grant work that we're doing here that agencies are focusing on, they're really focusing on the early childcare workforce. And I wonder if you could talk a little bit about, and these were kind of broader economic and health policies impacting families, but what's the interaction with those in the early childhood workforce, which, many of whom are families, also parts of these systems?
Yeah. Well, so we know a couple of things. We know that our child care workers are some of our lowest paid workers. We know that the job that they have is one of the hardest jobs. And we know that it's disproportionately women and disproportionately women of color who are putting this burden on to do this incredibly essential job at wages that they can barely live on. And my colleagues at the University of Washington and I did a study to look at the health and well-being of childcare providers and whether increasing their wages would actually lead to better outcomes for them. And some of that research is still kind of in analysis phase, but the thing that was really striking is that at the baseline even, we found that over 40% of childcare teachers are reporting that they were food insecure, 40+% were reporting depressive symptoms. So these are caregivers who need care themselves, and we're putting them in the position of caring for our most valuable little things on this planet. So we know that we need to make investments. States have done this in myriad ways. Some have given scholarships. Some have said, if you get higher training, we'll give you a little bit higher wages and so forth. There's some states now who have been trying to have pay parity. There are others who have substantially increased the rates of childcare providers. So that's going to allow us now to get in there and actually study the impact that real wage growth has on the impact on the well-being of caregivers and the quality of childcare. But to date, most of the research is not very strong because it looks at going from $9 an hour to $10 an hour. And although that is a good thing to do, it can be up to $2,000 a year. It's just not enough to kind of push those childcare providers up into the pay range in which professionals would deserve. So the research is still a little bit out on those, but common sense really isn't.
Thank you so much. So we have another question in the Q&A. I've been thinking about the interactions between some of these policies and how the effectiveness of one policy might depend on whether and how another policy is implemented, as you've been talking about. For example, the effects of paid family leave on mothers' post-birth employment might depend on the generosity of childcare subsidy programs. I'm wondering if and how you're thinking about this particular and potential ways to account for this synergy between these policies.
Well, we are thinking about it. And like I said, the simulation that we showed of just how the policies kind of add up is one of our first approaches to this. But this is kind of a limitation of research, is that we like to isolate the effect of moving one thing at a time and control for all other things, when the spillover effects might actually be where the story is, and the interactions may be really important. Now, as more states have been implementing paid family leave, we're going to be able to have more of a laboratory to answer some of these questions. So we have 6 states now that have paid family leave. Before, it was really, most of the research was on California and then a little on New Jersey. With more offering it, we can look at the variety in the weeks of paid family leave. We can look at the variation in the subsidy level, and we can really understand whether the impacts might be larger in places in which families know that they have some place that they can leave their kids in a safe, reliable, high quality place once they do return to work. So it's a great question that I don't yet have the answer to, but I would love to engage others with. Hillary, there's one question in here that asks about cost of living. I don't know if you see it in your, I see it in my Q&A. It was in there for a little bit, so I just wanted to make sure to try to address it.
Go for it. Sorry, I missed that one.
No, that's okay. It asks about whether we've looked into the cost of living in each of these states and how that might affect the actual conditions of families. You see DC up at the top, and maybe they're not actually as well off. And a slide that I didn't show is that we do account for those total resources by cost of living. And you're right that there are some places in which $15 an hour doesn't go as far in DC as it would in Alabama. DC actually stays up on top even after the cost of living adjustment. But the kind of sneaky state here is Arkansas. that it has an $11 minimum wage, and with the cost of living, that's actually pretty substantial resources, has very little out-of-pocket childcare expenses. And so families in Arkansas end up with a cost of living adjusted wage that's actually the highest for any state except for DC. So there are some surprising changes, well, not surprising, I guess, but definitely changes when you adjust for cost of living, which should be taken into account when states are thinking about what their minimum wage is. In the roadmap, we show what your current minimum wage is, what the cost of living adjusted minimum wage looks like as a result of that.
Thank you. I also want to call attention to the fact that thank you very much, Eileen Dunn, for putting information about the roadmap event coming up on October 7th. That's in the chat, and definitely encourage you all to take advantage of that. I'm wondering if you could talk a little bit about, I love that you're capturing sort of changes in policy across states. And if you're doing any work or thinking about, I know you do great communication with legislators and really thinking about how policy change actually occurs and sort of what tools and information seem to be resonating with legislators and policymakers in these states, and how your initiative is also helping with that process.
Well, yeah, thank you for that question, because the real goal of this whole work is that it is a tool for state legislators. We wanted to inform academics so that we can identify where the gaps are. We have additional data, we can do more evaluation work and build the evidence base. But at the end of the day, we want to improve the outcomes for infants and toddlers. And we know that state policy choices will make a difference. And we have been able to partner with many organizations like the National Conference for State Legislators, the legislatures, the National Governors Association, Hunt Institute, and others who work very closely with state legislators and have been able to share our work with them and try to be a resource for them. And so some have questions like the first question here, which is, so how much would this cost us and how would we pay for it? And I wish I had specifics for each of those, but that's something that we try to calculate for them so that they understand the range of choices that they have. There are a lot of states who are motivated by other states that have done similar sorts of work. Texas looks to states maybe around it, if it looks to any states. It doesn't look to California or Massachusetts. So it's important that we take a regional focus. And I'm imagining that Wisconsin is probably similar in that it understands where the potential shared labor markets are and what a regional environment looks like. So we've been trying to bring most of the work that we do to a regional context and illustrate that these are other states in your area that have done X, Y, or Z. And it's been important to demonstrate the immediate impacts that these policies have. So we're really looking at prenatal-to-3 outcomes. We often think about these investments in little kids as having kind of multi-generational effects, but they may take a long time to actually see these impacts. But that's not always true. We see a state minimum wage, improves birth outcomes. Early Head Start, investments that states are making in early Head Start have pay off right away and make it so that kids are showing up to school with higher executive functioning and better language skills, better social skills. And so to be able to demonstrate those immediate returns and impacts is also seen to be really important. So how much does it cost? How are you going to pay for it? Who else is doing it? And what difference will it make for families in my state? Seems to be the most important information that we can get across to folks. And what we try to share on the roadmap, but that's lots. And so we pare it down into one-pagers.
Yes, the good old one-pagers that our policy students, we definitely want to encourage that skill, such an important skill. So yes. Any other questions for Dr. Osborne? Q&A.
Looks like there's, oh no, this one is still Q&A. Sorry.
Okay. I was going to say maybe somebody wrote some questions directly to you that I'm not seeing. So if that's
there was
the case,
one that's still just in the queue, that the costly one's still in the Q&A. So I thought maybe it was a new one. My apologies for that.
Okay, no problem at all. Well, seeing no other questions before you leave us, just given all that you've seen and thank you so much for centering a lot of your examples here in Wisconsin. Any sort of last words of advice for us who are working here and all the great folks at Department of Children and Families and Health Services and Public Instruction that are working on this preschool development grant of sort of, where to put our energy?
Yeah, well, I've had a chance to look at the goals of the Prenatal-to-3 collaborative, and which are very much aligned with the preschool development grant, and a chance to talk with the leaders who are really making such a difference. And it seems like you're so well aligned with what the research says matters for kids. My only, it's not even a piece of advice. It's just, I think one of the major findings of all the work that we've done is that there isn't one institution that can do this, that we really do have to make sure that we are helping what the families outside of the childcare environments, that they have access to healthcare, that they can work, and work pays, that we think of them as a system, as everything that we provide, we put the family in the middle and we center our systems around them so that they're getting the services that they really need. And so again, it's not really advice. It's been very clear that there isn't one institution that can do it all. And so the more that you are integrating across these institutions, I think that is going to be more and stronger for family well-being.
Excellent. Thank you so much, Cynthia, for this terrific presentation. Thank you to our friends at NCSL and others who helped get out the word about the talk. And again, just encourage everyone to check out this great new resource and the continued work of the center. And thank you so much for joining us virtually, and we hope to see you again next week. So thank you.
Thank you for the opportunity. It was great to see you, Hillary, and some familiar names in the participant list. So great to see you all. Thank you.
Absolutely. Thank you.